Okay po.
4 p.m.
Good afternoon po, sir. My name is Luke ARLETA, your student nurse from Nicolay Educational Foundation Incorporated. And today, I will be demonstrating to you the assessment of the blood pressure. So what is the blood pressure assessment? So the blood pressure measurement is a way to measure the pressure inside your arteries or when the heart pumps. Okay, so the purpose of so there are you can measure this by as two numbers. These are the systolic blood pressure, or the first higher number, which is the pressure inside the arteries when the heart pumps, while the second one is diastolic blood pressure, or the lower or second number, which is the pressure inside the arteries when the heart rests in between the beats. Okay, so the purpose of this measurement is so that we are to establish a baseline data. Yun palagi ang kaunahan. And yun nga, since there's baseline data, we can also compare and contrast from previous data if there are any taken before para ma-monitor po yung pasyente. And it also helps in the evaluation of the patient, lalo na po doon sa tuwing if the patient is given any type of treatment, yun po, it can be used to monitor his or her blood pressure when given example is yung mga gamot po. Okay. So the equipment we will be using for today is the sphygmomanometer. Okay. And stethoscope and gloves if it is necessary, and ito mga alcohol swabs po. Ayan. So first, let us begin by conducting hand hygiene to remove or reduce the transmission of microorganisms, and introduce myself to the patient and explain the procedure. So my name is Luke ARLETA, and I will be measuring your blood pressure today. Okay, so identify the patient. Okay, so what is your name and birthday po, ma'am?
I'm Larnie Ogay.
Okay.
December 16. Okay.
Okay. Okay, I have explained the procedure and I have introduced myself to reduce any anxiety within the patient and to facilitate cooperation and compliance with the procedure. And I have prepared the necessary materials over time to facilitate organized measurement and yun nga, and assessment, and to also not waste time. Yeah. So I have positioned the patient in a comfortable position. There are two positions available. It can be either sitting or supine position, sitting or lying down. And the left arm should be supported right here in the level of the heart with the palms facing upward. Yeah. Yeah. And then locate the branchial artery by using the 3 or 2 fingers on your hand, finger pads. Yeah. I will locate the branchial artery. Okay, I have located the branchial artery, and I will get the sphygmomanometer. Yeah. And I will place it approximately on the midway of the arm, or 1 inch above the antecubital space. Yeah. So wrap the cuff to the arm, yeah, to ensure that the placement is secure. Yeah. And close the valve and start pumping the cuff until you cannot feel the beat anymore. So okay, so hindi ko na po maramdaman yung beat. So I have noted the point where the beat has stopped. So yun po yung 140. Yeah. And now I will use my stethoscope. Ito, talagay ko dito yung mga ito. And I will place it above the brachial artery. Okay. So I have here the valve, which I will pump, and I will close the valve again. And I will begin to puff the cuff until I have reached the point where I cannot feel the beat anymore. And release the pressure. Okay. So I have noted that the blood pressure of my patient is 120/60. So slightly lower diastolic pressure, but it's nothing major. Yeah. It's nothing major. So if there are any doubts with the measurement, you can restart the measurement again after taking a rest for about 1 to 2 minutes. Okay. So remove the cup and ayun nga. Clean the earpiece. Yun nga, store the equipment away, the sphygmomanometer. Before storing the stethoscope, clean the earpiece with the alcohol swabs to reduce the transmission of microorganisms. Okay, so you need to do this. You need to do this nga pala before and after using the stethoscope. Yeah. To take care of the equipment. And now I will properly record my findings on a chart for further evaluation and comparison, and to ensure the accuracy of my information. That is all. Thank you very much.
Okay, Luke, thank you for the demonstration. No? So, yung recording po ng ating performance will also be sent to your Google Drive again para i-extract po ulit ninyo, and once extracted yung inyong sariling video, you will need to post it again on the NEO LMS submission Dropbox, and dun po ako magpo-post ng comment. Sphygmomanometer ha, don't be mautal. Huwag ka mautal dun sa sphygmomanometer. Mali ang pronunciation. Tapos, yung arms dapat properly resting on a table. No? Para hindi siya nakalutang na ganyan. Dapat nakapatong daw sa table yan. Yung pagdedetermine nung tinatawag nating maximum inflation point, while you are inflating the cup, hawak-hawak mo pa yung manometer, your other hand should be used in palpating the pulsation on the artery. Hindi mo siya hawak. Yung isa nagpapump nung valve, tapos yung isa mong kamay dapat kumakapa dun sa brachial artery niya, not holding the manometer para mo ma-determine. So sa ganitong video recording na demonstration, we cannot directly observe as a clinical instructor, we cannot directly observe on how fast or how slow you are releasing the air from the inflated cup. Hindi ko siya makikita kasi camera lang tayo. Kaya please practice more. Okay, so that's it. Thank you, Luke.
Thank you po, sir.